Thank you for your lovely introduction. It's a real honor to be part of this really important day. So if I may, I'm going to share my screen, if this is acceptable, and you hopefully will see my slides because they were just too much to send over at the weekend. So it's a great privilege to be part of that, part of the work that we're offering to you all. What I am is a fellow of the Royal College of Pathologists since 1999. And I'll reach the point where I'll tell you why I had that great privilege of being part of this wonderful family of pathologists who matter so much for how we can understand disease, but also help to tackle the challenge of climate change. So let me start by just sharing something that has a vision image of, well, the 1890s. Our world doesn't look very hot then, but now if you look at 2017, 2021, we are definitely heating up. And the challenges are enormous. Of course, the concept is that we will get increased air pollution, which is something that we know pathologists are doing a lot on, drought, flooding, and of course wildfires. But all these are now so much more of an issue in our world. The World Health Organization has been taking a huge leadership role in this, and it's really important that you can see this and that you're aware that we are picking out on vulnerability of the extreme weather events, heat stress, air quality, and other effects, but also the vulnerability factors of the demographic, geographic, biological, health status factors, as well as socioeconomic. But amongst this, and considering so many pathologists are based in the health system, it's the leadership, governance, health workforce, health information systems that are so key to what we need to do. But climate-sensitive health risks are quite hard to define. They affect all the different types of health impacts, really, all the way from injury to heat-related stress, respiratory illness, waterborne diseases, zoonoses, vector-borne diseases, malnutrition, non-communicable diseases, mental and psychological, social health, the things that we deal with every day. But of course, the impact within health systems and facilities is of particular import. To me, the next thing that is going to be of real importance is trying to understand how these impact on the health emergencies for climate change and the variability, which is so complex. And as these health impacts are often increasingly compounding, cascading, and interacting. So I want to take you to last year's COP. COP stands for the Conference of the Parties, a weird name, which the UNFCCC, the International Federation, the UN focal, the Climate Change Agreement Network, have every year, and this coming year will be the COP28. So I'm taking you back to COP27, if I may. One of the reasons I'm doing that is because we published the 10 new insights into climate science, a huge program with Future Earth, the Earth League, and the World Climate Research Program. And of that, there were 64 authors and 4 who covered health. But let me just talk to you a little bit about why we're so concerned about climate change as a whole now that we're facing it. So, the first myth is questioning the myth of endless adaptation. Can we adapt to everything that we might face in climate change? Well, our potential to adapt to climate change definitely has limits for people and ecosystems. And in our report, we stated that there are soft and hard limits. And if we hit catastrophic, there are intolerable risks that we cannot adapt to. So we don't want to get to that tipping point. We don't want to reach that stage. But if we're aware that that stage might be there, we need to be very much ready for it. But we also know across the world there's some very serious vulnerability hotspots where we know that there's going to be a really worrying impact on many different areas with different vulnerabilities, with monsoons, particularly around Asia, low-lying coastal regions, particularly worrying from sea level rise, tropical forests, but even things that are really quite concerning, such as the loss of glaciers, which is coming up so much in our world at the moment. But I thought I would talk particularly about new threats on the horizon from climate and health interactions, which I thought might be useful for us all to be able to be aware of. So let me just take you into this diagram where you can see that climate change in the circle at the top of the world is the area that we're really concerned about. We know there'll be an increase in infectious diseases, which is why our pathology partners are so important, with a loss of biodiversity, the risk of floods, wildfires, and extreme heat. We know that if we do have all these problems, then they're going to have an increased use of pesticides, an increase in antimicrobial impacts, decline in ecosystem functions, decline in food function, increase in pathogen spillover, something that I know the pathologists would be really concerned about, as well as the change in vectors, which I think is very important for people to be aware of. But we know the type of impact is going to be on mental, physical, and mortality for human, domestic, wild animals, and plants. And to do this, we must improve our mitigation, although a lot of work has been done on that. But we need to consider a lot about adaptation, as the Royal College of Pathologists is taking forward, increasing our resilience, and climate change attribution studies, which are going to be very important. But one of the things that I thought might be helpful just to remind people, that is going to be terribly important for the future, is the fact that we know that children born in 1950s did see spring, summer, and autumn, but we suspect that children born in the 2020s will be less likely to see what we regarded as ordinary as spring, summer, and autumn and winter. It's going to be a different type of world we bring people into, so we really need to understand and look after them and adapt to change to support them in the long term. A lot of this has been done through our UN partnerships. So we have the incredible Paris Agreement on climate change, which the United Nations Framework Convention on Climate Change was so available for. They're looking at the sustainable goals, development goals, which is talking so much about the impact of climate, but equally on the Sendai framework, which is all about disaster risk reduction, which is where I've been focusing most of my work when I was the vice chair of the Science and Technical Advisory Group and a member of it from 2008 to 2017. It's a slim agreement, 50 paragraphs, each paragraph honed and worked on by every UN member state, and it came out with very clear global outcomes, guiding principles, priorities for action, but the 7 global targets of reducing mortality, affected people, economic loss, and damage to infrastructure and disruption of services. But the other thing was to increase how every country might be aware of its risks with local and national disaster risk reduction strategies, much of which in the UK is done through the Cabinet Office and our national risk assessments. But also international cooperation, which on this day of International Pathology Day, it's really important we take advantage of. And the aim is to have availability and access to multi-hazard early warning systems and disaster risk information and assessments to all people, originally by 2030, but now the aim is to get it by 2027. So a huge amount of work is going on this, including the Sendai Framework Monitor, which is now live, so we can look to see whether countries are managing to do this or not, Mike. So what we know and what we found was that actually countries found it very difficult to understand what a hazard was. So in paragraph 24J of this incredible Sendai framework for disaster risk reduction, there is this message to strengthen technical and scientific capacity to assess disaster risks, vulnerabilities, and exposures to all hazards. To do this, I was asked to chair a group that started in 2019 and ran until October 2021, which delivered these 2 reports, a hazard definition and classification review and a supplement on hazard information profiles. To do this, we worked with many UN partners, over 40 as the chair of this technical working group, and many science partners, including through the International Science Council, which is the global voice for science, and with the World Health Organization, the Food and Agriculture Organization, and many other groups, we were able to pull this together, this information, along with partnering with the Insurance Development Forum, which brings in all the insurance networks, and to me, the communities that are so important in all of this, which is the International Federation of the Red Cross, Red Crescent. But it wasn't just this incredible group that we had. People volunteered and we stretched our wings and we ended up with a very clear summary of all the different things from the inclusion criteria to understanding what the hazards might be. And we have 8 hazard types that have now been agreed, from meteorological and hydrological, all those storms, heat, cold, all the droughts and other things
which we're only discussing today at the UN, but also the extraterrestrial and space weather hazards, the geological hazards of volcanoes and earthquakes. Again, we're discussing those, and the environmental hazards. There's been a huge discussion on sea level rise already today. Chemical hazards have come in very strongly, and from the toxicology point of view of the Royal College of Pathologists, we linked many of these issues along with the Food and Agriculture, WHO, and many other organizations. But particularly today, if we're looking at infectious diseases, are the biological hazards. It did take a while for a lot of our hazard colleagues to believe that biological hazards merited their own section, but COVID-19, I think, brought it to the fore. People agreed it was important, which was a great relief. But we're looking at everything from aquaculture and algal blooms, from those types of issues, to all the way through to obviously zoonotic diseases and infectious and plant diseases, as well as all the different things that can be infected, as well as the technological hazards of things from the chemical, biological, radiological, nuclear, explosive issues from terrorism, but the issues that relate to cybersecurity, waste, transport, and many other things. And for completeness, we were able to include the societal hazards, which brings in conflict, post-conflict behavioral and economic losses. So let me show you what these hazard information profiles look like. They're not very beautiful, but they have at the highest level of the definition that's been agreed from preferably a UN organization. Drought has been agreed by the World Meteorological Organization, although it's something that's really causing us concern with desertification. Near Earth objects from UN OSA. So the UN Office for Outer Space Affairs has been much involved, but so is the tsunami earthquake triggers. So this is the Intergovernmental Oceanographic Commission, which is part of UNESCO, who have been helping us with this one. Coastal erosion and shoreline change is incredibly important, but there is no clear scientific definition, UN definition, so we rely on a scientific definition. Oil pollution is something we've all been unfortunately aware of, and it still remains an issue. And monkeypox has changed its name to Mpox, even though it's a WHO hazard. We will have to update that. And dam failure, if you think of Libya and the terrible dams, the impact with failure with the flooding was really awful. And of course, explosive remnants of war. And it's rather fun that we've been able to include in the explosive remnants of war the work we did with the Royal College of Pathologists on depleted uranium, and that is included in this particular hazard information profile. I thank Barbara Clayton for her support in that huge piece of work we did in the early 2000s. So the recommendations are that all our policymakers and scientists use this for evidence-based national risk assessments, disaster risk reduction, sustainable development, and it's aimed at managing risks and emergencies. And having been at this meeting at the UN, even though I've had trouble with all the internet issues, it's been really important to hear the discussion and debate already happening on slow onset disasters, and the reflection that this was a useful piece of work that we did to help to explain things. But increasingly, we need to look at addressing complex and cascading hazards and risks. And now, most excitingly, we're into phase 2. And again, I've been asked to chair the steering group for this, to bring together all the networks that we have, all the partners, all the systems at UN member states, UN systems, science organizations, and many other groups to try and improve our phase 2. So it started now, and we take it forward. Why does it matter? Because the UN decided that our hazard definition and classification and the hazard information profiles support Sendai, the Sustainable Development, and the Paris Agreement by providing a common set of hazard definitions, something that I was really excited that they asked for, not that we as the scientists offered. Now, there are many networks that we've used on climate and climate-related hazards, because climate is not a hazard, it's a driver of these hazards. And what we've done is to pull together many of the different systems that we have for providing the evidence that might be useful. So I just show you this slide just to try and bring in some of our networks. Now, of course, if we just summarize this and think about it in the UK and with our international partners, we know that there is real issues from severe weather, extreme heat, environmental degradation, impact on water and food supplies, water quality impacts, allergens have come through as a very important area of work, but increasingly it's the change in vectors that is causing us a great deal of anxiety. But this is something that UKHSA has been addressing along with air pollution very much in the heart of our work, because we know that the impact of climate and environmental change will result in increased deaths and illness, but also frighteningly increased health inequalities. So we've got much to do on this. So I'm delighted to report that we have launched a UK health security agency called the Centre for Climate and Health Security Centre, which came out in October 2022. So it's a year old, and it's really there to link at local, national and global levels to try and provide mechanisms by which we can learn to mobilize and inform policy and practice, something that I hope that many of you will find useful and to be aware of and support some of the work you're doing. And in there we have a wonderful medical entomology and vector service, which has been growing very fast. But what we do know is that whatever we do, the climate crisis is a health crisis, and we need to reflect on that and think about it. And in this very brief talk, which I have shortened so that I try and fit in with the timeline and the changes that we've been doing, I just wanted to be able to bring to you the fact that I am in a UN meeting representing a lot of this work and the work that I've been doing at the International Science Council and other science networks to try and explain what we need to do about these hazards and how we're going to look at them and address them in the future. I hope this is a useful talk. I hope this gives you some of the idea of the global thinking that is going on around your really important thinking that is happening at the Royal College of Pathologists. Mike, I hope I finished in time just to give you a glimpse into the world that I've been privileged to work in, to try and help you see what we could do for the future. Every thanks.